The global landscape of infectious diseases is undergoing a profound and troubling transformation, and nowhere is this more apparent than in the rural heartlands of South America. Public health authorities and international surveillance networks are increasingly turning their attention to a lethal threat that emerges not from crowded urban centers, but from the very soil and air of rural communities. This threat is hantavirus, a family of viruses carried primarily by rodents, which can cause severe, often fatal respiratory and hemorrhagic illnesses in humans. In recent months, epidemiological data and field reports from regions like rural Argentina have highlighted an alarming spike in localized outbreaks, a phenomenon driven by ecological changes, shifting agricultural practices, and the stealthy nature of the viral reservoir. For viewers watching worldwide, understanding this crisis is critical, as it underscores how environmental disruption can amplify a pathogen into an urgent public health emergency. Hantavirus is not a new discovery, but its modern behavior is challenging traditional containment strategies. Unlike waterborne diseases or infections spread by insects, hantavirus is intimately connected to the population dynamics of specific wild rodents. When these animal populations swell due to favorable weather conditions or changes in land use, the risk to human populations escalates exponentially. The current situation in South America serves as a stark case study in how a natural reservoir can suddenly unleash a biological hazard upon unsuspecting agricultural workers and rural families. This is a story of surveillance, scientific detective work, and the ongoing struggle to protect vulnerable populations from an invisible, airborne killer that thrives in the dust of everyday rural life. At the center of the current investigation are regional public health agencies, specialized laboratories, and overwhelmed rural clinics that form the front lines of defense against this pathogen. Medical data from the affected zones indicate that the primary mode of transmissions occurs through the inhalation of aerosolized viral particles. When infected rodents shed the virus in their saliva, urine, and feces, these materials dry out and mix with ordinary soil and agricultural dust. Activities such as sweeping a barn, harvesting crops, or simply walking through a contaminated storage shed can kick these microscopic particles into the air, where they are easily inhaled by humans. Once inside the respiratory tract, the virus attacks the endothelial cells that line the blood vessels, leading to a rapid accumulation of fluid in the lungs, a condition known as Hantavirus Pulmonary Syndrome. Clinical reports emphasize that the early symptoms are dangerously deceptive, mimicking common influenza with fever, muscle aches, and fatigue. However, within days, patients can progress to acute respiratory failure and shock. Specialized diagnostic laboratories are working under high biosecurity protocols to confirm suspected cases using polymerase chain reaction tests and antibody assays, as rapid confirmation is vital for clinical management. While some local reports have sparked fears of person-to-person transmission, international health officials maintain that such events remain exceedingly rare and are specific to certain viral strains, such as the Andes virus variant. The primary driver of infection remains direct environmental exposure. This distinction is crucial for medical logistics and hospital management, as it dictates whether resources should be funneled into strict quarantine measures or focused heavily on environmental remediation and community-wide rodent control programs. Mitigating the impact of hantavirus requires a sustained, multi-layered approach, combining rigorous public surveillance, environmental engineering, and clear community guidance. Public health agencies advise that the most effective prevention strategy is to eliminate rodent habitats near human dwellings and workplaces. This involves securing food supplies in rodent-proof containers, sealing structural gaps in buildings, and clearing brush and waste away from residential perimeters. When cleaning areas that may have been occupied by rodents, individuals are strictly warned against dry sweeping or vacuuming, which actively lofts viral particles into the air. Instead, guidelines call for thoroughly wetting the area with a disinfectant or a diluted bleach solution to deactivate the virus before carefully wiping it up. Workers in high-risk agricultural settings are increasingly encouraged to wear specialized respirators rather than simple cloth masks to ensure adequate filtration of airborne dust. Despite these clear preventative protocols, significant limits to scientific knowledge remain, particularly regarding the long-term forecasting of rodent population booms and the precise ecological triggers that cause a spike in viral shedding. Vaccine research is ongoing, but a universally available, highly effective vaccine remains a future goal rather than a current tool. As field researchers and epidemiologists continue to gather data from rural clinics and laboratories, public education remains the most potent weapon against this hidden threat. For more comprehensive updates on global public health developments and breaking news analyses, consider subscribing to this channel. The clinical and laboratory response to the hantavirus threat involves a coordinated effort among regional clinics, specialized diagnostic facilities, and epidemiological surveillance networks. Medical data compiled by public health agencies indicate that the primary mechanism of human infection is the inhalation of aerosolized viral particles. When the virus is shed in the saliva, urine, and feces of infected wild rodents, it undergoes a process of drying within the environment. Normal agricultural activities, rural maintenance, or clearing enclosed spaces, such as barns, cellars, and grain storage sheds, can physically disturb this contaminated organic material. This disturbance lofts the microscopic viral particles into the air, mixing them with dust that is subsequently breathed in by individuals working or living in the vicinity. Once the virus enters the human respiratory system, it targets the endothelial cells that line the blood vessels, causing increased capillary permeability. This physiological response can lead rapidly to Hantavirus Pulmonary Syndrome, a severe condition characterized by non-cardiogenic pulmonary edema, where the lungs fill with fluid, causing acute respiratory distress and severe hypoxia. Clinical protocols note that the early manifestation of the disease presents a significant diagnostic challenge for rural healthcare providers, as initial symptoms closely mimic common influenza or other seasonal viral illnesses. Patients typically present with generic symptoms including high fever, severe myalgia focusing on the large muscle groups, headache, and gastrointestinal distress. Within a brief window lasting from a few hours to several days, the illness can progress to a critical phase marked by sudden onset of coughing, shortness of breath, and cardiovascular shock, carrying a historically high mortality rate. To confirm diagnoses, provincial and national reference laboratories utilize specific diagnostic assays, including enzyme-linked immunosorbent assays to detect IgM and IgG antibodies, and real-time reverse transcription polymerase chain reaction testing to identify the presence of viral RNA in clinical specimens. Due to the high risk of laboratory-acquired infection, processing these specimens requires strict adherence to biosafety level containment protocols. Public health officials emphasize the distinction between different hantavirus strains regarding transmission dynamics. While the vast majority of global hantavirus cases are strictly zoonotic infections contracted directly from rodent reservoirs, specific lineages found in South America, such as the Andes virus, have demonstrated a documented capacity for limited person-to-person transmission, particularly among close household contacts during the early symptomatic phase. Consequently, hospital management strategies must balance general environmental intervention with specific infection control measures in clinical settings, ensuring that healthcare workers are equipped with adequate personal protective equipment, including high-efficiency particulate air respirators, and that suspected patients are managed in isolation units where advanced respiratory support and fluid management can be carefully monitored. Mitigating the spread of hantavirus requires a systematic approach to environmental management, vector control, and public health education. Because there is currently no specific antiviral cure or universally available vaccine for Hantavirus Pulmonary Syndrome, primary prevention is the single most critical tool in reducing human mortality. Public health guidelines emphasize that the elimination of rodent habitats in and around human dwellings is the foundational step in breaking the chain of transmission. This involves the strict enforcement of rodent-proofing techniques in residential, agricultural, and industrial structures. Practical measures include sealing all entry holes, cracks, and gaps larger than 1/4 of an inch in walls, doors, and foundations using durable materials like steel wool or concrete. Communities are advised to keep food, water, and animal feed stored in tightly sealed, rodent-proof containers, and to clear brush, tall grass, and trash piles at least 100 feet away from the outer perimeters of homes to eliminate nesting sites. When handling areas with suspected rodent infestation, standard cleaning methods must be completely altered to prevent lethal exposure. Public health agencies issue a strict warning against dry sweeping, shaking out carpets, or using conventional vacuums, as these actions directly loft dry viral particles into the air, creating the exact infectious aerosols that cause the disease. Instead, the mandated protocol requires individuals to thoroughly wet the contaminated area, including any visible droppings or nests, with a commercial disinfectant or a diluted bleach solution consisting of 1 part chlorine bleach to 9 parts water. The solution must be allowed to sit for at least 5 minutes to completely deactivate the virus before it is wiped up using paper towels or rags. For individuals working in high-risk environments, such as agricultural workers clearing out long-abandoned barns or grain silos, the use of specialized personal protective equipment, specifically N95 or higher-rated particulate respirators, is heavily advised alongside protective gloves and goggles. Beyond individual precautions, significant gaps remain in the broader scientific understanding of hantavirus ecology. Longitudinal environmental surveillance faces serious challenges in accurately predicting rodent population spikes, known as zoonotic eruptions, which are heavily influenced by complex climate patterns, shifting rainfall distributions, and changes in biodiversity. Furthermore, the exact environmental triggers that cause a specific rodent colony to experience a sudden surge in viral shedding remain an active area of ongoing scientific research. From an ethical perspective, addressing hantavirus requires public health authorities to balance the urgent need for transparent, clear community alerts with the responsibility to prevent unnecessary public panic, or the targeted eradication of native wildlife species that play critical roles in local ecosystems. Protecting vulnerable, isolated agricultural communities requires